who need rehab. And I'd like to ask, what strategy has the NHS got in place to help rehab patients who are coming out of ITU suffering from COVID?
Look, first of all, the first thing to say is that people coming out of ITU alive who would otherwise have died is the sort of problem we like to have in the NHS. This is a good problem. But there's also absolutely no doubt of the severity of the consequences of long COVID. But I just want to slightly reframe the way you describe it, because the long-term impacts of COVID are not very strongly correlated with the severity of the initial illness. And so whilst we have a very significant amount of work going into supporting those who come out of hospital, having been hospitalised with COVID, and we've put in July, we put in £8.4 million into a research effort, and the NHS has set up a long COVID service. This is not just about people who are hospitalised. In fact, and this is really relevant for now, because the latest rise in the last few days has been largely amongst younger people, but it doesn't matter how serious your infection was initially, the impact of long COVID can be really debilitating for a long period of time, no matter if your initial illness was wasn't all that severe.
Well, I'm really glad that you picked up on that, and it's good news to hear, because the Royal College of GPs have come out saying that we should have post-COVID clinics across the UK. Can you update us then on how the progress is going to get that sorted? Because I think you're exactly right. Patients have differing streams of how they present
yes.
and what they're left with.
Yes.
And that's one of the big concerns that they have. So could you expand on what you just
mentioned?
Yes.
So the NHS set up long COVID clinics and announced them in July. I'm concerned by reports this morning from the Royal College of GPs that not all GPs know how to ensure people can get into those services. And that's something that I'll take up with the NHS, and I'm sure that we'll be able to resolve.
And in terms of that, I mean, research is still coming out. You mentioned research going in. What about education for professionals, for the public, of what to look out for, what this looks like? Because clearly, people may not even be aware that they've had COVID, and then having symptoms that are leaving them feeling tired, loss of sense of smell, muscular weakness. Is there an education campaign that you could carry out to professionals and the public to make them aware of this?
Well, we have been circulating the evidence to GPs in the way that the NHS does, and with a new disease like this, obviously that's particularly important as new evidence comes through. That's partly what the research effort is all about, but we also need to highlight to the general public that there is support available in the NHS COVID service. One of the challenges is that there are not easy and clinically validated treatments for long COVID. The treatments that that our research program has discovered, like dexamethasone being the primary around the world, that was discovered in the UK, and but that's for hospitalised patients. And so there is a challenge, which is supporting people when actually there isn't a readily available treatment.
And the final question from me is, with regards to all this, there is a concern that you can get reinfected with COVID.
Yes.
Have you got any update for the public of whether that is still applicable and whether or not there is immunity out there?
Well, it's clear that there is some immunity from having had COVID, because we can, for most people, because we can see the rise in antibodies that follows from an infection. But we have also just started to see the first credible cases of reinfection. And through genomic analysis, you can see that it's a different disease to the one that the person got the first time round. But in all the cases that I have seen, it has been an asymptomatic second infection that's been picked up through asymptomatic testing. But the hard question is how, because one of the most difficult parts of dealing with this virus is asymptomatic transmission. What we don't yet know is the transmissibility of the disease, even from an asymptomatic person who might have had the disease before, but we've got a huge amount of work going on into answering that question. The answer to that question obviously ties into the effectiveness also of the vaccine. We have a much higher degree of confidence that the vaccine gives immunity, and that obviously is one of the things that we're testing as part of the vaccine trials, which, as you know, better than anybody, you can never have confidence in them coming to a successful conclusion until they do, but they are making good progress.
Thank you. Just before I bring in Neil Hanvey, I sent you a couple of weeks ago a letter from a lady called Robin Gorner, who speaks for an association, a group of people who've got long COVID, as she does. I just wondered if it'd be possible to have a reply to that letter fairly soon, because they make some very sensible suggestions.
Yes, I saw the letter last night, and we'll get a reply very quickly. This is an incredibly important area to me.
Thank you.
And the other thing I'd say on it is this, that people of all ages are affected by long COVID, and people who are younger, who might think that they're unlikely to get severe symptoms or die of COVID, can still have a terrible illness that completely changes their lives for months and months and months. And we saw this morning the evidence from King's College that shows around 60,000 people who they have found who have conditions of COVID that last over 3 months. This is a really serious consequence of the disease.
Thank you.